Good evening, Professor. On this occasion, I will speak about viruses and the risk of lung cancer prevention and treatment. Well, starting with the introduction, recent reports suggest that viruses such as HPV, Epstein-Barr, and Mysteries virus might play a role in relation to lung cancer. However, the association between viruses and lung cancer has not been fully elucidated. Importantly, the recent COVID-19 pandemic has shown that cancer patients are high risk of SARS-CoV-2 infection, with an increased risk of complication and death, particularly in lung cancer patients. In this chapter, we will review the evidence on the role of viruses on lung cancer. But if we talk about cancer in Europe, here in 2020, it was estimated that a total of 380,327 new cases of lung cancer were diagnosed, ranked 27 in the country of the European Union. In total, 64% is cases were diagnosed in men and 36% in women. And this is how you can see it's graphed in the statistics on the right side. Here we also see statistics. Both people between 45 and 69 years old had the highest number of new cases reported, followed by people over 70 years old and people between 20 and 44 years old. A total of 257,293 people died from lung cancer in 2020. 66% if one were men and 34% women. With respect to viruses and their relationship with lung cancer. Thanks to the Global database, estimates of the incidence and mortality rates of 36 types of cancer are provided and included data from 185 countries. There was a study of the cancer incidence rate, ACAS was 25 cases for 100,000 person years. The main infectious agents related to cancer were Helicobacter pylori, HPV, hepatitis B, and C viruses. But if we talk about the pathogenic role of viruses in lung cancer has not yet been well established. However, there is evidence of viral DNA in tumor cells, as well as smoking, which is a potential factor in increasing the susceptibility of lung tissue to lung cancer viral infection affecting oncoprotein function, as we see in the image. And we can precisely see in the table of one the viruses related to lung cancer and proposed mechanisms of oncogenesis. So continuing with the presentation, I am going to talk to you about the most frequent viruses found in this study. Starting with HPV, is a double-stranded DNA virus associated with the development of several types of neoplasia in humans. To date, more than 200 types of HPV have been described, of which HPV type 16 and 18 are responsible for approximately 70% of HPV-related cancers. 78 study with data from 9,385 patients examining the presence of HPV infection in lung cancer. HPV was detected in 1,268 cases. HPV 16 was detected in 6.1% of cases, and HPV 18 in 3.1%. The prevalence of HPV was 17.9% in SCC and 9.2% in adenocarcinoma. There is an increase in the expression of HPV genes that was associated with a decrease in the expression of tumor suppressor genes. Interestingly, one study investigated the role of HPV and cellular gene microRNA expression in EMT. The development of lung cancer was reported as HPV DNA was detected in 51% of lung cancer tissues. The results showed a significant association between HPV and lung cancer, suggesting the interaction of E6 and E7 and microRNA might promote TMT. On the other hand, we have the EVV, is an enveloped double-stranded DNA virus, also known as human gamma herpes virus. Its association with lung cancer has varied significantly depending on tumor histotype and geographic area. EVV goes through two different stages to complete its life cycle, a latency cycle and a lytic cycle. It is associated with a lung carcinoma similar to lymphoepithelioma. that mainly affects young smokers. Sorry. And well, on this slide, we have the four latency periods of the virus. First, we have latency 0 due to the absence of EBV proteins, and latency 1 with Burkitt's lymphoma, latency 2 with nasopharyngeal carcinoma and lung cancer, and latency 3 with its associated lymphoma. And on the right, we have a diagram of these latencies. Having another virus, we have HIV. A French court study mentioned that there is a greater risk of lung cancer of CD4 content of 500 cubic millimeters is not recovered once antiretroviral therapy has been started. In the USA, it was studied that lung infection was associated with a higher risk of developing lung cancer greater than 10 years after the onset of the AIDS. People with HIV have a higher risk of developing lung cancer compared to the general population. Factor associated with increased risk of lung cancer in people living with HIV, the CD4 positive lymphocyte count was a previous diagnosis of AIDS, previous lung disease, age, education, number of pack years of cigarette smoking. In the virus CMV, a double-stranded DNA is herpes virus that has a high prevalence in the community with an estimated survivalence of 83% in the general population worldwide. After a first infection that primarily infects epithelial cells, endothelial cells and macrophages, CMV remains in a light state for life, and these types of cells serve as reservoirs for the virus. The authors found CMV DNA in 48% of tumors, while CMV DNA was detected in only 29% of pleural tissue samples from healthy individuals. There are no reports pointing to a direct relationship between CMV and lung cancer, although CMV has been found in a variety of epithelial tumor cells, such as those of the colon, breast, ovarian, and prostate. In the virus, MV is lymphocytic and also shows tropisms for the organismal epithelium. Acute MV infection is usually followed by cellular immunodeficiency, despite lifelong protective immunity. MV P53 and P53 inducing reg H2 antigens were detected in 54 of 65 ENCLC cases. In the virus GSRV cause lung cancer in sheep called open pulmonary adenocarcinoma (OPA). In humans, GSRV infects cells through the cell surface hyaluronidase receptor. A positive immunohistochemical reaction to the GSRV capsid protein was found 30% of human lipidic growth adenocarcinoma and in 26% of other adenocarcinomas. But if we talk about the JCV virus, the prevalence of JCV antibodies in the serum of global population is reported to range between 60% and 70%. JCV has been detected in several types of human tumors, suggesting that JCV has the ability to infect a wide range of cell types. The prevalence of JCV was evaluated in 13 patients with lung adenocarcinoma. A positive PCR test for JCV was reported in 7 of these cases. Prevention or treatment of oncogenic viruses is complicated, except for HPV. There are no vaccines approved for the viral agents described in the previous section. In HPV, there are phase 3 pharmacological trials that activate the lytic phase 4 of HPV, kit tobacco, as well as prevent lung cancer. COVID-19 and lung cancer, the future challenge of research. The possible damage caused by the virus to the lung is pulmonary fibrosis. The hyperinflammation frequently is suffered by patients with severe COVID-19. The negative regulation of angiotensin converting enzyme 2 could be involved in the possible development of the cancer. Globally, all scientific and public health efforts is required to continue investigating and try to prevent the possible development of lung cancer due to SARS-CoV-2 infection. In the conclusion, although there are possible oncogenic mechanisms of viruses in lung cancer, more research is needed. Smoking contributes to viral oncogenesis, causing local immunosuppression, increasing viral pathogenesis. The role of viruses in the development of lung cancer remains unclear, but is supported by epidemiological data of infection in tumor cells. Uh, Thanks.